Hello, my name is Ocillian Alexis, and I'll be talking to you today about sensory and perception, specifically eye injuries and retinal detachments. Here is a photo of the eye, of the outside and the inside of the eye. The eyes give you the gift of sight, and sight is one of the five senses. Your eyes help you to see where you are and where you are going in life. There are four cranial nerves that are connected to the eye: the optic, the oculomotor, the trochlear, and the abducens. The optic helps with your vision. It helps you to determine where you are. Your oculomotor helps you with pupil constriction, and it helps you to roll your eyes upwards and downwards. Your trochlear moves your eyes down and outward, and your abducens moves your eyes laterally. Here's a memory trick to help you with that. 2, 4, and 6 make the eyes 2 tricks. Subtract 3 from 6 and your pupils constrict. An assessment of the eye is when you ask a patient a series of questions, as in, when was the last time you had an eye exam? Do you wear glasses or contact lenses? Do you have problems with your sight at certain times of the day? Do you have problems with seeing things up close or far away? Also, to assess with vision, some physicians use a Snellen chart in order to assess with distance, and a Rosenbaum chart to assess with near vision. You will be assessing 6 cardinal fields to determine eyesight. That is, you have the patient follow your finger or pen up, down, side, side, and laterally from top to bottom. You will also use a pen light to shine within the patient's eye from the inner of the eye to the outside of the eye to check for pupil constriction or pupil dilation. You will be looking for the size of the pupil. Is it equal, round, reactive to light, or accommodate? Now we will get into eye injuries. According to the CDC, every day about 2,000 U.S. workers sustain a job-related eye injury that require medical treatment, and an estimated 90% of those injuries could have been avoided if the proper eye equipment was worn. An eye injury is anything that is foreign to the eye. Signs and symptoms are altered mental status, sudden changes in vision, eye pain, redness, discomfort when moving, bleeding, swelling, black eye, dilated pupil, or you could have an object sticking out of your eye. Causes: abrasions, burns, penetrating trauma, blunt trauma, lacerations, foreign bodies, or a detached retina. Who's at risk? Just about anybody is at risk for an eye injury. Children, teens, young adults, older adults, and mostly women. Due to mascara and eyelash extensions, the numbers are going up for women. Some diagnostics are eye exams, a physician using an ophthalmoscope in order to shine a light into your eye to look at the fundus, a facial x-ray, a CT scan, ultrasound, a fluorescent test to see if you have any floaters in your eye. Treatments can be tissue grafting, debridement, or a cornea transplant. Here are some medications: antiemetics, because you don't want pressure on the eye from throwing up; atropine, diazepam; narcotics, sedations; topical antibiotics, steroids; stool softeners because of constipation; and allergy medications because of pressure from sneezing. Prevention of eye injuries is you would like to wear eye goggles or glasses, or use sunglasses to protect yourself from sun rays and UV lights. Here are some nursing interventions. You would like to assess the patient. If the patient has debris in their eye, you would like to flush the eye from the inner of the eye to the outside of the eye, not from the outside to the inner, because if you do that, you will be flushing the debris into the other eye. If the object is impaled in the eye, you would need to stabilize the object that is in the eye while also covering the injured eye because they move simultaneously. Also assess for pain and give pain meds if ordered. Orient the patient to the room because if they can't see, they will need to know where they are. Also give the patient a call bell and tell them to call you if they need help with going to the bathroom. Keep the patient at a semi-filer or a high filer to keep pressure off of the eye, and keep the patient calm. Here are some more nursing interventions for when the patient goes home. You will need to teach the patient how to take their medications at home, how to put their eye drops in, when and where to wear their eye shields, not to sleep on the affected side, to take over-the-counter allergy medications, teach about follow-up appointments, and if you have any changes within the eye, to call your provider immediately. Now I would like to get into retinal detachment. A retinal detachment is when the retina is detached from the back of the eye. Risk factors are absence of the lens, aging, diabetes, glaucoma, myopia, retinal detachment, or trauma. Signs and symptoms can be vision changes. It could look like a curtain is being drawn over your eye, flashes of light, floaters, lines, or spots within the eye. Diagnostics and treatments, eye exams, the doctor shining the light in your eye to check the fundus, facial x-rays to see if you have any trauma to the eye or fractures, CT scans, ultrasounds, or a fluorescent test to see if you have anything floating around in the eye. Treatments, cryotherapy, lasers, sclerobuckling, or vitrectomy. Sclerobuckling is a type of surgery when the patient gets a silicone strap with 2 silicone sponges on each side attached to the eye, and the eye is squeezed inward like a belt pulling on some pants to keep them up on your waist. About 90% of the surgeries have a success rate, and they preserve your eyes for up to 20 years. Complications could be cataracts, detachment of the eye layer beneath your retina, double vision, hemorrhage in your eye, increased nearsightedness, increased pressure in your eye, infection, new retinal tears, proliferation of the vitrectopathy. Nursing care for a retinal detachment is a head-to-toe assessment. Keep the patient in correct alignment, laying flat. Prepare for surgery, observe consent form being signed, prepare surgery equipment, calm the patient, use medication if needed. Orient the patient to the room, give call bell, and tell the patient to help with this. If they need help with assistance, then you will be there, and keep the patient calm. You would also need to assess for pain and give pain meds, assist with urinal or bedpan until anesthesia wears off from retinal surgery, teach the patient how and when to take meds, teach the patient to wear the eye shield, and to keep the head elevated, not to strain, or to sleep on the affected side, and to keep up with follow-up appointments. And if any vision changes occur, to contact your provider. Also with help with teaching of how to insert the eye ointment and teaching the patient how to insert eye drops. Make sure that the patient teaches it back to you. Therefore, when they get home, you know that they know how to take their medication. Also teach the family member how to give the medication in case the patient needs help. I put a little tutorial in here about how to apply eye drops. First, you would need to start off by washing your hands with soap and water. After you wash your hands with soap and water, put on a pair of gloves. After you place your gloves on, wash away any crust or debris with a warm, wet rag. Shake the medication up and down in order to mix up the med. Have the patient tilt their head back and look up. Place a finger under the lower lid and apply gentle pressure downward to expose the inside of the lower lid. Apply the prescribed medication of drops into the lower lid without touching the tip of the eye, because you can contaminate the eyedropper, which would then contaminate the medication inside. At this time, if the patient had ointment, you can put it on a wet Q-tip and layer it across the inside of the bottom of the eye. Have the patient close their eye and put gentle pressure over the inner corner of the eye for 1 to 2 minutes in order for the eye to absorb the medication. And then use a soft paper towel or wipe to wipe away excess leakage from the patient's face. And after that, remove your gloves and wash your hands. I put some quiz questions on here for you to answer. At this time, you can read the question and pause it. The correct answer is D. You would want to flush the patient's eyes with cool water from the inner of the eye to the outside of the eye. You need to pause here. The correct answer is A, C, D, and E. Here you would need to pause. The correct answer is B. And that is the end. Here are my references. Thank you very much.